are going to dive into a fascinating conversation on the role of remote patient monitoring in digital health, the real-time insights and interventions. In this panel discussion, our esteemed panelists will explore how remote monitoring tools are transforming healthcare delivery, bridging the gaps in care and empowering both patients and providers with actionable data. To guide us through this exciting conversation, please help me welcoming on stage our moderator, Dr. Clint Steele, principal at CJ Steele, and of course our esteemed panelists, which is Saranas Narbutas, Suraj Madhavan, Yussi Mata, Tim Nell, Professor Dr. Dmitry Mikhailov, and Amit Kumar Bajpai. Please give a round of applause for our moderator and our panelists.
Good morning, everybody. My name's Clint Steele. Thank you for joining us. The panel actually met prior to this event, and we've worked out some questions that we want to go over. So I'm really just the person who puts the questions. Everybody else is more qualified, so they'll be the ones who will actually be answering them. The first question that we came up with, and this was after we went over some review papers on the topic, and we noticed that while there was a lot of conversation about things such as wearables, understanding the technology, dealing with data, some other less developed topics that were alluded to that we'll go into later on, there wasn't a lot of conversation about the topic of the opportunities and the needs for research in this area. So, for example, what opportunities are there and requirements are there for clinical research moving to the future? And the two people who had probably most to say on this were Suraj and Dimitri. So we'll start off with Suraj. If you can sort of talk to us about the research opportunities that are presenting thanks to remote patient monitoring. Try again. There we go.
So thanks, Clint. So it's a wonderful opportunity to speak about clinical research. Clinical research is all about collecting data from patients participating in clinical, which would be later taken to evaluate whether the medicine which is being tested is effective or not. And this frequently happens at the conventional trials typically happen at on-site data where patient meets the doctor at the site and this data is collected. Sort of a remote patient monitoring would enable to have larger data collected rather than at that specific points, so which would give us a better insight whether the medicine being tested is having any undue side effects or having more than the expected benefits coming in. And this would also add a difference if the real remote patient monitoring is happening in real-time basis. So that would become real-time patient monitoring, which would be a combination of wearables as well as app-based systems, which this would really give us a larger insight happening worldwide. And that would enable the regulators to take a better decision on the medicine, as well as it could be related to the medicine, medical device, or could be a disease-specific aspects also. So that's going to be the future of clinical research with these, remote patient monitoring systems.
Gotcha. So just to follow on that before we move on, if you were to give one piece of advice to anybody here who might be a clinical researcher to really leverage remote patient monitoring, what would that be? And I realize I put you on the spot here.
Yeah. So having experienced one of the largest real world evidence studies that we are currently doing. So I come from clinical research organization. So we are currently managing a 20,000 subject database in India on pregnant women, the data being collected. So what happens is you can go into tier 1, tier 2, even tier 3 level of cities because of this remote patient monitoring system. It would enable a deep penetration, and it would actually enable to accumulate a larger database which comes in. So I really would support enabling real-time patient monitoring in all clinical studies across world, giving out a larger good purpose of making it paid back to the society again.
Thanks, Raj. Dimitri, did you have something specific to add on to that?
Yes, thank you. Actually, there are several technologies that are penetrating the markets of clinical trials. in Vital Play, we do so-called therapeutical games. The games where patients can be involved in playing because it's a gamification. And we particularly use it for ADHD patients, because with ADHD patients, you cannot bring them really to the hospital because they're out of their environment and they have to be tested in their environment where they live. And one more aspect is that this gamification, because they have problems obviously because of ADHD syndrome, they have problems of concentration. Gaming allow them to concentrate. And there was a great, actually therapeutical games movement started several years ago, and it's not that popular yet, but it will be popular. A Nature journal recently published a great article that's called Game Changer, where the games will be the future of therapeutics and remote telemedicine solutions. It's number one. And the second thing that we also faced with this very rare case of ADHD telemedicine trials is that you really have to adopt the game for each patient a little bit, because they are very different to each other. And AI helps here a lot, because you can kind of have the understanding of how they're playing and what they're doing. And combining these two aspects, I think, will be important, not only in the ADHD case, as where our research is, but in many other cases. And we have to utilize this advancement from the technologies that are coming into the telemedicine research quite a lot.
Thank you for that. I think this is something we'll talk about later on soon, is I guess the general wellness and mental wellness is actually quite fascinating. We'll be going to that much more later on. But before we move on to the next topic, did anybody else on the panel have anything to add after hearing what Suraj and Dimitri had mentioned?
If I may. So my name is Sharunas. I come from Lithuania. I've been living with a rare type of cancer all my adult life. So I've been involved in clinical trials, have advised on the device of clinical trials. So I can say that what you're saying, it's a bit of future in the mainstream. In the clinical trial setting in cancer, it has been happening for a decade. But it's not to elaborate on, not because we don't have that much time, but I wanted to pitch in and say, because the digital tools, it's not just for young people. When we're thinking of elderly, and when you say how can they use digital and gadgets, actually the elder population prefer using tablets to answering all of the quality of life questionnaires rather than scribbling something. And it has been proven over time in research that it's not actually that you need to be more educated, digitally savvy to be able to use these gadgets. It's actually easier. It's easier than write, easier than scribble, because it's easier to read. You can zoom in and all of that. So where we've seen it's been a golden standard in cancer clinical trials, we also see it going more and more in European Union in the clinical practice, because we have e-health systems, and I think we'll get more to that in the later questions.
Excellent. Thanks for that. So when we looked through the prior research, we also noticed that there was reasonable reference to not just using the data that we assume is going to come from remote patient monitoring, such as the gadgets that were just mentioned. There is other data out there as well, other data sources. And I'm currently working with a company that is commercializing an eye scanner. And simply due to the laws of physics, you will not be able to get an eye scanner into some kind of a wearable. It's just the nature of light and the way it works. So there is always going to be other sources of information. It could be pre-existing records, it could be from other kinds of scans that you had conducted, and it could also be self-reported data as well. And so the question we're putting to the panel now, and I'll start off with Amit here, is how can we go about, what other data sources should we be considering and incorporating when we look at remote patient monitoring to make the most of it?
Thank you for the question. Let's look forward and see that how many times we go to the hospital and get a regular checkup. It's difficult with the time consuming, and as well as the things moving around, it's very difficult to book up an appointment and go. The different data sources are definitely going to be a key. Your wearable devices are one, but they are consumer grade. What do you think beyond it? Our company has been specializing in making up the kiosk where you can go, sit for 2 minutes and get your scan done. We have around 30 plus parameters which get captured, from your body weight to your BMI, to your BMR, to your fat index, to your stress level. After your data has been collected, this data goes back to your EMR system. You can go to any of the clinics and get your data being stored over there, passed through the providers, and once this has been passed through, they can analyze. You can do these follow-up checkups more and more regularly to understand what's going wrong with you. And the more data you have, the secondary data which is going to come into the picture is going to impact how the research is being done. We are focusing more toward the community wellness to make sure that, yes, in your setup wherever you work. It could be a gym, it could be a building having a 400 plus residents. If they can do a regular checkup, we look forward at how the wellness can be incorporated more into it. And this data can be digested back. Remote patient monitoring can be more effective.
I remember when I spoke to Amit first, when I met him, and he mentioned the kiosk idea. I thought it was fascinating to have one place where you can get so many things done at the one time. And I think, as I was saying, there are some things you just can't do with a wearable, but it's a very good, I think, middle ground to have something as a kiosk where you can get so many things done instantly and recorded. Another thing I found fascinating was when I spoke to Tim, who's very much focused on pain management. And I think Tim had some very fascinating insights on this same question, so you can share those.
Thank you very much. So Lumina Pain focuses on delivering smart integrative treatment plans for chronic pain patients around the world and helping them to adhere to treatment plans at a higher percentage. And this has been a fascinating data project for us in the sense that while the wearables are giving us biometric data from patients, pain is a fascinating space because it's also about pain perception and things that wearables and kiosks can't necessarily pick up. Pain is a biopsychosocial phenomenon. So a lot of what we are relying on is patient self-reporting. And the development of our technology has been really trying to help patients report accurately on how they are doing outside of the clinical setting. And this has been particularly interesting because this previously has been a bit of a data black hole. When patients leave the doctor's offices, how they are sticking to treatment plans, how they are perceiving their pain on a day-to-day basis. There hasn't been much data collection here. And our biggest focus is on the behavioral science elements which incentivize patients to be accurate about how they're reporting on that data so that we can collect it, match it to the biometric data that we're also collecting and see how that correlates.
Adding on to that, I think, Yussi, you had some thoughts on this as well. Would you share those with us, please?
Yes, this is a very important topic, and I'm CEO of Body Healthcare. We provide our care coordination platform to automate patient care processes based in Finland. And when we talk about data collection and devices, we work with majority of hospitals back home, and we've been working with them since 2016, and of course had different kind of projects. And in majority of the projects that we kick off, hospitals initially have much thoughts that we want to give this sensor to the patient, this sensor to the patient, then would be great to collect this data and this data. And in every single successful project, we have actually come down with the number of data sources and data we want to collect from the patients, because the more data you collect, the more bored patients will be. They don't want to commit to connecting multiple sensors, but you actually have to find the data that you want to collect. And even in those cases, like we are all technologists here, we want to see sensors and devices will be the future. But in the most successful cases, we've had sensors that collect data, but then in the end of the data, the way to collect and report the data has been actually a gadget where patient actually enters the data instead of connecting, because in healthcare, of course, it's majority of patients or elderly people, and if you give them a device and you need to turn on the Bluetooth and do this and do that and do some magic, it doesn't work. You cannot have data. So in the end of the day, it has been just the easiest way that measure your blood pressure, enter the value here, and there you go.
Excellent. And I guess that reminds me again of the kiosk, where you've got something you can go to and it does it for you. We do need to be mindful of the patient and, as you say, them getting bored. Before we move on to the next question, did anybody want to add anything more to that one? So this actually leads into the next question that we had, which was on behavioural sciences, which Tim alluded to. And there are things where, and I think also there was a mention of the gamification as well from Dimitri, where we can actually use remote patient monitoring to, sometimes we need to encourage certain types of behaviour, but then there might be other times when we assume certain types of behaviour and we need to be mindful that that behaviour hasn't necessarily been engaged in. And this also gets back to basically how people feel about themselves, which was something that was alluded to in the literature reviews, but probably wasn't given the attention that it deserves. So I think what we're going to hear here is something a little bit more very future-oriented. This is the kind of thing that need to be considered in the future. So the question is, what aspects of behavioural science, principles and elements will potentially be affected by or affect remote patient monitoring? And to start off with this one, I'll actually go to Dimitri first.
Yes, as I mentioned, we really went for gamification for a reason, because the area of research is ADHD. By the way, ADHD, for example, in this country, still there is no such diagnostics, because there is a big lack of data, and it's a big problem. And doctors know that you have ADHD, but they never do any recipes on this. Why? Because there is a lack of research on this. There is lack of data, and gamification has two things: to engage more patients in the research and make them stay as long as you can in their facilities at home. It's immensely important. And the second thing is that you can modify the game based on each patient, also very important. But also we use quite a lot of variables now to prove to the doctors, to collect enough data, that the game is actually influencing the way you can concentrate. Because ADHD it's a disorder for sure, but it's not something negative. You can live with this. You just have to control it. You have to understand it, and then you have to understand yourself quite well. So we use EEG brain scans while people are playing at home to understand how you evolve with your ability to control ADHD. And at the end of the day, this at-home clinical, at least data collection, I think is the future, as well as for sure it will be the future for not only for ADHD, but also for all this states of mentality, wellness, mental health. It is the future, and thanks to the wearables that can allow you to scan your brain activity at home, we can collect quite a lot of data to make, for example, ADHD a legal disorder that can be diagnosed here in the country and can become of the insurance policy someday, because now a lot of people suffer with that, and it's just one niche disease. We have disorder. We have other disorders that can be processed with a good telemedicine approach.
Thank you. Tim, what would you like to add to that?
Again, the pain space is fascinating from a behavioral science perspective, because you've ostensibly got these highly motivated people. Pain, the avoidance of pain is something which really should drive behavioral change. But adherence to treatment plans, especially multidisciplinary treatment plans, is extremely low. You're looking at 45% adherence, sometimes even just to taking medication which will stop you from being in pain. So from the development of our application and our whole educational modalities approach here, we are looking at driving motivation and understanding what makes people want to stick to treatment plans with a higher degree of accuracy. Personalization is a huge thing. And then also the accuracy of motivating people to give proper feedback on how they're doing is very much aligned to the incentives. If we've seen if patients are given the application by their medical aid insurers, and they might be uncertain that perhaps their premiums are going to be affected if they are shown not to be adhering to treatment plans. So we have to make sure that the motivation is intrinsic in the application, so that people are reporting accurately and actually doing what they need to do. We know that if they are adhering to treatment plans, they go back to the hospital less frequently, they go for fewer unnecessary surgeries, their medication usage is more accurate and more effective. So there are significant economic and financial incentives to make sure that people are adhering to their treatment plans, but it's very much about making sure we're collecting the right data and motivating them to be as honest as possible in that collection process.
Thank you for that one, Tim. Is there anybody else on the panel who'd like to add to that? And just by the way, we are very efficient with our time at the moment, so if anybody would like
Yes,
Amit, go ahead.
On the behavioral, we had a very nice experiment with one of the corporate where we took around 500 people. We asked them to sit on the kiosk and they measured the various parameters. What we noticed with the corporate, the first thought could be that people had the obesity, but we found that the water content for most of their employees were much lesser, because of which the fatigue was much higher. We took up that parameters and we worked with the corporate for almost 3 months. After 3 months, what we saw the result, the water content for everybody has raised up. We ensure that the water container placements are perfectly fine. The sick leave have been, for those employees, have been down by 7%. That is what the behavioral shows, that, okay, with the kind of change in your lifestyle, with your reporting principle, with the remote patient monitoring and all those, you can really, really impact onto your regular activities, on your health and other parameters.
Excellent, thank you. Suraj.
Yeah. So to continue what Tim was mentioning on the pain aspect, clinical studies on pain management has typically failed primarily because of not getting the right data at the right time. So with such an advancement in the data being collected with the app that Tim was mentioning, this would really give a larger insights to understand what's the degree of pain being recorded at real time, and it could also add in with various comorbid conditions being added in, could be a pain related to the primary condition the patient is having, plus another condition might be contributing to it. So this differential factor might make a lot of difference, and that's why this, from especially in pain management, this is purely subjective. It's all the patient reported outcome. There is no objective evidence of the pain being detected. So that's where it adds in more value from proper remote patient monitoring coming in.
Excellent, thank you for that. Dimitri, I'm going to put you on the spot here, but it seems to me that if we really want to leverage remote patient monitoring, gamification is certainly something that can help. I think it was alluded to from other people here that when people feel motivated to engage, you'll get a lot more out of it. For anybody here who's had a light bulb moment, they're thinking, I want to get into gamification for remote patient monitoring, what advice would you have or suggestions would you have? And I'm thinking you're the best qualified person here, and apologies if I put you on the spot like that.
Actually, gamification is amazing, because when you have a device, you have a phone, you have a tab, there are so many sensors there that are so accurate. And when you have this data from how people play, whatever you want to diagnose, whatever you want to get people involved in, doctors, when we show to them, clinicians, when we show them the data, the amount of data, they're really amazed. And with the accuracy of data, they're amazed, and the frequency of data coming as well. And remember, you have so many sensors inside. How you touch the screen, how you operate the device, the frontal camera, and the accuracy of these devices is quite high now. At least now we show to clinicians the ADHD data that is coming, and we use artificial machine learning basically to find abnormalities. And so far, all clinicians are quite amazed with the quality, and it can be expanded to other disorders, other disease, and at least the primary data collection is definitely will be of help. And you can involve so many people, and you can involve on a daily basis without spending much time on pushing them to do something. And for them, it's fun now. And again, the fact that the Nature already accepted the article, and actually you can see the cover of the Nature journal game changer. It means a lot, and I think more and more clinicians will be involved in this, involving the ML that helps you with abnormalities studies, and including the definite trend on personalization of multiple treatments on the market now.
The other thing about remote patient monitoring is engagement.
Yeah.
So gamification is extremely powerful in driving engagement in the right spaces, inspiring people to come back to something, almost using the black hat gamification methods which drive addiction, like Candy Crush and these sorts of things. We can use similar gaming metrics in applications to help people to say, well, I've got to finish this streak. I've got to go in today and do a pain journal today. Oh, I've got to go back in and see if I'm on the leaderboard in terms of my cohort in this particular pain condition. These things, especially in pain, it is our reference point, but this is very community-based. Often people in something like fibromyalgia need that validation that this is a real condition, and having people to engage with in a community setting, seeing that I'm part of a bigger cohort, which is an authentic condition, is a huge motivating factor. So driving engagement in self-reporting, driving the accuracy, and making sure you're pushing the right sort of patient behaviors in the application. Gamification is a massive opportunity there.
And if I can expand just a little bit on this involvement thing, it's quite interesting. With ADHD, we focus on how people can concentrate, and now we see that there is a big demand in this gamification of people comparing themselves to others, not in particular to somebody, but how to see where you are in the group of others. But also one more thing that is quite interesting. Now we give our game to top athletes who can concentrate quite well, and you can see the difference of yourself and the top athlete, and then you can see, you have some benchmark that you want to follow and you want to be closer to, and this is also the way to create awareness and to invite these top athletes to show that they actually donating in a way, they became digital donors for the big crowd of those who want to understand how to concentrate and how to live with ADHD.
Excellent, thank you for that. Sure. Before I do pass over, I just think, to use some buzzwords from the 1980s, it's quite a paradigm shift when we're thinking about making healthcare fun. People actually want to do this. And when Tim said, I've got to do this, I've got to do that, really what they're saying is, I want to do this, I want to do that, which I think is quite a remarkable perspective to take on healthcare, which seems that remote patient monitoring could allow for. Sarunas, you were going to say something.
Yeah, we were discussing about engagement. I want also to think about motivation. So there are over 500,000 health apps currently in the app stores, etc. Are we using them? Very little percent of that, because we're lazy as a human beings. We want things done for us, and we don't want to be reminded that we need to take pill, we need to walk, etc. When it works is when, okay, our gadgets does it for us. We don't need to turn it on to say that you are walking, or now you're sleeping. But the problem with that is that we have so much data, and data is wealth. Data is, we all agree, we're all fans here. However you get the data, through gamification, through systemic input, or without having to do anything yourself, it's very good. But the problem, so much of that data sits in silos. So where the patients get demotivated, so lose motivation for the digital tools, is when they have been using something like a telephone, which captures a lot of data, like a smartwatch, and when they go to their doctor and they cannot use any of that. They say, look, I have my heart rate recorded for every day. I have my sleep regime recorded, all of that. And then the doctor is saying, yes, but I cannot enter it in our e-health system because it's not validated. This data is not integrated. And this is a big elephant in many, many conversations. Because there are so many great startups, so many great companies doing great things for the patients, or potentially trying to really save trillions of whatever currency you put in healthcare systems, which is not being tapped into. And with that, healthcare systems, I don't know good examples, maybe someone from the panel could do. In European Union, most of the countries have e-health systems. That means you have electronic health record, you can get prescription online, you can see your doctor online, and etc. But you cannot make them use your data or make an advice on that. And that they will replicate that, they will ask you to put another gadget in, etc. And I've been developing health apps for our patient community as well. So for someone who is living with a very hard, difficult conditions, potentially causing death, the people would be, you think, monitoring themselves. What we see is this attrition rate, how many users you lose. You lose 90% of those motivated patients in a month through whatever type of gamification you would do. So there's so much to do, and there's a lot of that to do with motivation. And a lot of that is coming inherently being demotivated from your previous experiences. So something that we have a bit of a trauma, I think, that how we got upset by the healthcare systems not using what's available.
That's actually quite a fascinating perspective. I heard some murmuring over here, which made me think somebody wanted to respond.
Yeah, actually, I have to say that Sarunas took my words that people are lazy. And that's what I wanted to say. In our experience, what we've seen, that as long as patient is still somehow recovering, they've been quite happy and quite motivated using the tools. But whenever they get a feeling that I'm doing great now, they stop using, they got demotivated. And I think that the gamification should come in, and there should be also some motivation from the payer side, either insurance companies on the government side, to actually monitor patients. I will share later today our experiences in cardiology, where actually health system has made huge savings actually keeping patients motivated in reporting, and that's the key. You don't want to only monitor sick patients, you want to monitor and get data from healthy patients, and that's the million-dollar question, how to do it. And I actually want to continue for the next topic, talking about national health systems or e-health systems. In Finland, we have quite well developed EMR records. They are quite well integrated. We have a national data lake. It's supposed to work well. If you hear, I hope there are no Finnish government officials here. Like they are telling the story that it's all the data is integrated. You can plug your remote monitoring device and connect that to our national health records. And actually, the law in Finland says that all the data, all the sensors and devices that are used in healthcare settings, they should upload the data to the national records. And there was a deadline that by the end of 2024, all the devices that are used in the healthcare settings should have integration in place. Guess how many devices have the integration in place?
I'm guessing it's not 100%.
No, it's actually 0%. And the reason
my
is,
second guess.
reason is that there's no API ready by the government.
Amit, were you?
Yes. Now, three things come into the picture over there: the engagement, the reimbursement, and the policies. One of the very good use case what we had was the patient monitor for the sleep apnea. Every time when patient for the sleep apnea used to come, we used to call them to the hospital, come and sleep on the bed, and like nobody used to get a proper sleep on the hospital bed. Let's be practical. And the sleep apnea was not being monitored properly. We reached out to the regulators that can we allow a patient to have a wearable device, go back to their home and sleep, where we can monitor it. The reimbursement came a problem. That no, the bed is not being occupied, how can we reimburse you? We have to request for a policy change for it. But the outcome, what we saw from the remote patient monitoring, it's not a telemedicine, just a wearable device, you take it, you go home, you wear and sleep for 3 days, we can monitor you and see what the real data has come. Other aspect for the real remote patient monitoring comes about the integration, what my friend brought up. How do I bring that data back to the physicians? That was something missing, and that integration is very much required. Otherwise, the data is lying into silos every place. It's not been structured well. The movement's not been structured well. Most of the analytics are going to fail because they are going to be on the synthetic data. We need more real-time data to have proper insights.
So we were alluding to the next topic there, which is about the governmental policy, economic benefits and economic requirements and things like that. But I guess something that was picked up on here, and if anybody else wants to add to that, that would be very interesting. I do remember hearing that there are sort of two types of people in the world, the towards people and the away people. There are those people who are motivated as they're getting close to their optimal health goal. And there are those people who are motivated when they're getting close to the other end. For example, weight loss. There are people who are worried about having weight, and so they get motivated when they put on weight, but as soon as they start to get thin, as Yusi was saying, it's like, oh, I'm getting better now, and the motivation drops off. I think we are dealing with people here who are typically ill, and once they feel better, their motivation probably does drop off. So they might be more what we would call away people. And I think this does lead into some of the social benefits and the way different cultures and things like that. And we've already started alluding to it. The question is, how does the process of our remote patient monitoring and how do the benefits of remote patient monitoring affect and be affected by things such as government policy, the nature of the market, how your healthcare system operates, and I don't know if I mentioned, but the economics of the situation as well. And I think Yusi was sort of starting to talk about that already, and you're talking specifically about Finland, but I think you've got some insights into sort of Europe in general. So if you could tell us a bit more about how you've seen remote patient monitoring play out in different parts of the world as a result of different government policy things.
Yes, thank you. That is one of my favorite topics definitely. In order to get remote monitoring work and used, there need to be proper financial models for that, and depending on the country, even in EU, they are different. And one of the key questions here is that remote monitoring or therapy considered being a software cost or a therapy cost, and who's actually paying that? And I've seen both. For example, in Finland, we have a case, or we are always selling to health systems or hospitals, and our software is considered as a software cost. And in one of the cases, we sell to heart hospital, and there's a fixed monthly fee that they pay to us that we monitor and track their patients. And what they do is that they actually have negotiated to the payer, which is local healthcare region, that they will follow up with heart failure patients on monthly basis, and they get paid, I don't know how much, but probably 20 euros per patient per month that they monitor. And in that case, hospital is saving money. They are paying some percentage of the monthly fee to us to use our software. they get paid by the government, and the government get benefits because patients are monitored, and they get faster actually in their interventions and recognize the patients who are not doing well. And that is something that in a small country like Finland, they've been able to negotiate. Then I've been in Germany meeting with doctors and CFOs, and in their cases, of course, they also see us as a software. But then when I have asked that, okay, how much would you ready to pay? I don't have any money for this. You should talk with insurance companies. So there's actually expectation that software provider should first get the reimbursement from the payer, and then hospitals are ready to take softwares into use. And even some of the people may have heard word DIGA, which is in Germany. This goes probably more towards the therapy side of mobile health or remote monitoring. But in such cases, doctors can prescribe a mobile app or therapy app to the patient, and the app developer gets money from the insurance companies that the app is used. But the challenge, what I see in such case, is that if there aren't too many softwares available under DIGA, which is good from health system point of view, but of course it's bad for scalability, and that's a major challenge in it. But another major challenge is that if there would be more apps, how would you actually commit hospitals to using those apps? Because we already see and hear the comments from hospitals, but yeah, we have already 200 applications or softwares in our system. We don't want to have any additional softwares in use. So it's kind of chicken. It's not even chicken and egg, but it's a problem that there are 500,000 apps in the market. Patients should be able to use them, but at the same time, in order to get value from that, there should be someone on the provider side using those apps, and they don't actually want to have more apps, they want to have less apps.
Thank you for that. I think, Amit, you were talking about that earlier, but you have more to add?
This again goes back to the same thing what my friend has added here, that who is going to reimburse for it? Is it the patient going to be? It's going to be a provider? It's going to be insurance? That's the situation is not clear, but that's where the government and the policies come into the picture. The more and more the policies are put through the patient remote monitoring. The example which I quoted, that yes, I want my patient for the sleep apnea to go back home and be monitored, but that's not being reimbursed. Why are the hospital going to incur the cost for it? Why am I going to lose 1 day of my insurance cost which could have come? Who is going to bear the cost for it? And at the same time, are the patient happy in doing it? In Dubai has been very, very mature when it comes to the digital policies transformation. The multiple policies have been put over there to ensure that your remote patient monitoring can be brought into the picture at the earliest.
Thanks. I was going to say, Tim, you had a little bit to say about this as well, didn't you?
Yeah, it's again fascinating about the coordination of incentives. There has to be a financial model for it. And in a country like Finland or in the UK with the NHS, a product which will reduce visits to the hospital will have better coordination in terms of interventions. You can reduce hundreds of millions of dollars of cost. But you move into different spaces where you get different financial models in the space, where perhaps take the USA. You will have some people saying, I'll bite your arm off for that solution. But some doctors will say, you're telling me I'm going to get fewer patients? That's what's putting bread on the table here. Value-based care versus fee-for-service versus governmental funded. If there's a misalignment of incentives, you're going to have people pushing back on a solution which improves patient outcomes or times interventions better. And so you really need to make sure that at the policy level, ideally, there's some sort of handshake agreement on how these things will work. Or if you are developing a product in this space, you need to be very sure who you're targeting and how you position that. For example, again, remote patient monitoring, many people see pharmaceutical companies potentially pushing back against those sorts of solutions. But in some instances, pharmaceutical companies and remote patient monitoring solutions, adherence solutions, are best friends and are working together extremely well. It's a lot of complexity. And you spoke to using applications, and then there's no data integration. So when you go to your physician, they have no idea of what you've been doing, and there's a huge amount of frustration from the consumer on that front. We've seen in the NHS, for example, doctors having 11 minutes with a patient on average. They spend about 8 minutes of that time collecting data from you. And we call it the connection versus collection situation. 8 minutes of collection and 3 minutes of connection. The patient leaves the physician's office with no idea about their condition, terrified that they've got something they don't understand, and no idea how to follow their treatment plan with any degree of accuracy. So how do we leverage technology, remote diagnostics, remote patient monitoring to make sure that collection happens before they meet the doctor? The doctor gets an accurate diagnostic suggestion and then can spend more time with the patient on all of the stuff that is so important in terms of that bedside manner and actual patient face-to-face care. That's kind of what we're seeing in different spaces.
Can I build on that?
Go ahead.
It's exactly, I would just add, what you were saying is exactly what EU, European Union as a Commission, is funding a lot of different projects where exactly the focus would be from collecting the data when patient is in the consultation to collecting the data before the consultation with AI to analyze it so that actually healthcare professionals could have a time with the patient. And this is what you explained. I think it's reality in many healthcare systems that now healthcare professionals are being hostages to this bureaucracy that we need to provide. They're not having this face time with the patient. Patients feel the same. And this is where the paradox, the ground is shaking. You see the momentum is building up. The paradox where we innovate so much in the healthcare system, but the regulation lags behind so much more. And what we are discussing here, no healthcare system is fit for purpose as of now. What we expect as users of that system, being a patient side or healthcare professional side. And in this regard, when we are thinking how to pay for new models, there's not many very progressive governments. Here in the region, I see, and I collaborate with various international consortiums and projects and organizations, OECD, WHO, etc., where the governments are very proactively trying to look for the models where in EU we actually know we stagnate. But what I see a rise of interest is for the private insurance companies to actually be the leading advocates for using digital solutions. Not the public insurance companies, not the hospitals, but the private insurance companies, because they are smart people in there calculating how much my client is paying me and how much I will have to pay back when the health deteriorates. And then all of the logic with prevention, early diagnostic makes sense to them. And I see actually that this consortiums now of the huge billion-dollar insurance companies are coming together and pushing governments or WHO to say, you are not looking into it, we will look into it, but please provide the legal framework for that. So the field is indeed very dynamic, and the gamification, as you say, is actually one of the trends that the private insurance consortiums are mentioning, that we are happy to pay for this games for therapeutic usage because it's very crystal clear economic modeling of what you do and what you not do with that. Where the regulation fails, I can give you just a small example of a startup I was helping. They had a remote monitoring for the diabetic ulcer feet. It's a very common complication and it's very painful. And they have like a mat that you stand on, and you can monitor the ulcers 8 weeks before they appear even. So you can prevent a lot of painful complications, surgeries, etc. And it's very, very low cost. And they launched it in the US. And in the US, they even have a code for monitoring. It's like $50 for the hospital per month. But then the problem is with their insurance, where they were saying, okay, currently we have another product which was developed by the government, which costs 3,000 euros per month to use, which is less effective, but because it was endorsed by the HT Health Technology Assessment, this is what we're going to use. We don't want your low-cost solution because we want to keep rolling the table. To be in a good graces with the big guys. So that means that is a very sad story, where you have superior technology technology, saving costs, but there are intrinsic barriers how the healthcare systems are structured, not able to make it reality.
You might not necessarily like them, but I guess private health insurance companies do have to deal with facts, and they have to make very pragmatic, effective decisions in that sense. Before we move on to the big data, did anybody have any other comments just on that? Because it was quite a rich area, and I want to make sure we've tapped that vein. Good. So obviously, there's a lot of data flowing around, and you might have picked up from either end of the panel up here, there were slightly different perspectives on whether we're going to collect a lot of data or maybe less data. I believe later on, UC will be talking about less is more data. But big data is a part of this. Certainly, from my perspective, I have a probabilistic statistical background, and I don't know if anybody's familiar here with Daniel Kahneman, who wrote a book called Thinking Fast and Slow, and he spoke about how humans are just not that good at making decisions and how data-driven decisions are far superior. And that was definitely something that came up in the literature reviews that we did, where they said that you can do a lot with data. You can find correlations that were just not obvious, and if we start collecting all of this data, we're probably going to discover things that we never even knew about. But one of the problems that it actually mentioned was that people feel a bit uncertain about the conclusion because they don't know how the neural network actually made that decision. Like, what were the pieces of information it actually used to reach the conclusion that this person is likely going to die in 24 hours? It's very uncertain, regardless of how predictable or how accurate it might actually be. So definitely there are huge benefits, but one of the concerns was that we need to trust this black box, which might not be necessarily something we're comfortable with. But I think there might also be other challenges with big data, and we might not necessarily feel that big data is the solution. I was going to pass to Jussi first, because I think you've got some thoughts on this, and then I'll come to Sirenis after that. But
Yes, big data, an important topic, and people have been talking about a lot in healthcare. In my opinion, big data is very good on a population level, seeing trends, like how diseases spread around the population and such. But what I actually love to talk is small data. And small data is all about treating a specific patient, a specific indication. And when talking about small data, it's all about collecting the right data at the right time.
Thank you. And I believe you've got some thoughts on who owns the data,
Yeah,
and privacy
exactly.
and things. Yes.
I think every time I speak up, I bring more complexity to the discussion and not simpling it down. It should be opposite. Yeah, I mean, the big narrative now here is who owns the data. Is it the government? Is it the hospital? Is it the private insurance company? Is it the technology developer? Is it the patient? In the European Union, this debate has been very hot in the past few years, and now all stakeholders are nodding it should be the patient, because we have a lot of scandals, 23andMe, if you remember, where the data is being sold for improper reasons. And what you mentioned also earlier is like, if I am patient, I'm providing the data, then I'm afraid that this would backfire, like my insurance company will make me pay higher premium. And we have the privacy laws, which are not strict enough. It's good to prevent it, but it's not good with dealing with aftermath. And with that, again, we are not in reality where the regulation is equipped to do this. So, and there are ways how to not destroy any of economy by doing it, but that the patient would be saying, I'm fine to share this data with you, I'm fine to withdraw that consent to share that data with you, but I want to have it with me. So now let's not think of the next year, let's think of like 2040. I think by the 2040, we will have all of us, our electronic health records with us every time, wherever we travel. And this in itself is a huge saving for any economy. Imagine when you go to different country, you don't speak the language, and now they have to do all of the tests to know how to treat you. Imagine how you can avoid the complications that if someone would see you have a counter indication to some medicine, or you have a diagnosis that would not allow you to do one surgery or another. And this is costing a lot of lives currently. This is not something that we can fix off today, but this is why we need to be moving this. Because if we address it at a national level, okay, healthcare system, let's say they will find ways to integrate that data. But data travels, we travel, we are cosmopolitan people. When you travel and the data stays in there, how good is that? That means you are in much more risky situation being in a different country, being a patient, not knowing the system, not maybe knowing the language, not knowing the pathway. And this is the health that we are talking about, life or death situation. So this cannot go just that we don't care who owns the data. And about what you started with, is big data important? It's super important. It's everyone who is in this field, every stakeholder cares about data and more of it and more complete data. We as the patients, as also you see saying, we need to care about small data, the quality of the data. Because if even like in the cancer field, if we compare, we have cancer registries, and we call it very good quality cancer registries, meaning the data is reliable, we can do it. But what is the detail of the data? You can only know that there is X patient in an X country being diagnosed with this type of cancer at certain date. That's it. Not the complications, not the comorbidities, not if they are dead, not what stage they are. This is very, very, very shallow, and that's the best that we have. So there is so much more to go, and the digital tools are much more capable of bridging those gaps than the governments will with their own hospital gathering.
Thanks for that. I think, because we're almost out of time, certainly the notion of owning your data. At the age of 14, I was first diagnosed with melanoma, and I've had 20 since. And I went to get a genetic screening done, and it wasn't until I thought, they asked me, like, what do you want us to do with your data? That was the first time when I thought, oh, hang on, I'm not sure. Up until then, I've always thought big data, great. But then as soon as it affected me personally, it was a bit of a different story. That was just a little anecdote I wanted to share. I'd like to thank my panelists. We're 30 seconds until we need to wrap this up. So I'd like to thank panelists. I'd like to thank you. I hope you enjoyed it. And I hope everybody enjoys the rest of the conference. Have a great day.
Great start. Thank you.